Hello, my name's Jim Simonson and I'm a professor of EMS at Sinclair. I'm going to guide you through our Sinclair Paramedic Program student clinical orientation process. First thing is to list the different segments that we have on the video. You're watching the first segment, which is the introduction, description of the clinical course structure and the clinical requirements. Then we have signing up for faculty sessions, followed by signing up for clinical sessions, what to bring, what to wear, and the grading policies. Talk a bit about our daily clinical activity logs or decals where you fill in what you've done for the shift and have your preceptor sign and how to enter those online. Then talk a little about patient care reports, the appropriate behavior at the site and evaluation periods, and finally what to do if an injury or an illness occurs. The requirements, first off, is that your paramedic student handbook has your clinical requirements and it's your primary source of information. That will change, whereas probably more often than this video will. The course syllabus may have even more up-to-date changes and may include changes that have occurred since your paramedic student handbook came out. So there are a couple things that are standards that are required though. First off, in order to enter the clinical environment, you have to have passed the first semester courses, which is our EMS 2100 A and P, the 2105 first part of paramedic where you went through assessment, airway, and pharmacology, and your 2110 lab, which was pretty much the component to 2105 where you practice all those skills. Got competent, we checked you off on CPR, some of your basic skills, assessments, and so forth. You also have to have all of your required health information, immunizations, your tests, and your orientation process complete prior to starting clinical. Have to pass the fire and HIPAA safety quizzes. The supplemental orientations and paperwork or contracts that are needed for special sites such as Premier and Children's at the time of this video in May of 19. And you also have to have proper attire and professional behavior while you're at the clinical site. The progression of the courses. There's 3 different phases to your clinical activity. The first part is your hospital experience, which is 224 total hours. That's either EMS 2135 for the entire 224 hours, or occasionally that gets split depending on the semester you started into 2136 and 2137. But regardless, everyone has to complete their entire 224 hours of hospital before they're allowed to do anything in the field. You may not start clinical in the field or practice skills or do anything of the sort. You are not a paramedic student when you're in the field until you've finished 2135 and got clearance and you're working in our appropriate environment. 2160 is your ambulance experience, which is 112 hours as well. You kind of get started in there. Then 2180 is your field internship. And I'll talk about each of those just briefly. During the hospital, what I'd like you to do is to start working in the emergency room until you meet with your first session with your faculty member. So for some of you, that might even be the very beginning, 7 a.m. the first day of the semester. That's great. Knock it out, get it done, and then you've got free reign to go pretty much any place in the hospital that we are allowed through our contracts. But in the meantime, if your session isn't scheduled until the end of the first week, or maybe even the second, or in rare cases the third week, you're going to want to try and stick with the ER and just work on IVs, assessments, medications, and others. Do not wait until your first faculty session. So if your first faculty session's at 7 a.m. on the first day of the semester, no problem. But if your first faculty session isn't until the middle or the end of the second week, you've lost a huge opportunity to get clinical done, and you're going to be behind and have to play makeup. So please get started right away at the beginning of the semester. Once you get cleared for the other areas, which as I said shouldn't be more than a week or 2 into the semester at most, then start focusing on getting your pediatric assessments done, your intubations done, and your OB delivery. Those are very difficult to get in the field. Subcutaneous and nebulizers can sometimes be challenging to get in the field. But if you need to go and find 2 adult chest pains, that's not going to take too terribly long working on a medic. In the Dayton region, finding an overdose isn't all that difficult. However, if you're looking to try and find a toddler that has cardiac problems, that's going to take a very, very long time. Or kids of a specific age category, it can take many, many shifts to get to what you need in those cases. So same thing with intubations and finding somebody to deliver. Very few students witness a delivery in the field within their clinical setting. The goal for 2135 would be to knock off everything on the skill side. So all of your IVs, all of your IV med pushes, all of your ventilations, your subcutaneous and IM injections, your ECGs, everything else that you need to get done. Try and get all that stuff done in the hospital. It just makes life a lot simpler when you're out in the field. When you get to the 2160, that's your ambulance experience. You're not able to start any kind of ambulance until you're cleared, until you've checked off and completed and passed your 2135 or 2136, 2137 courses. But once you're cleared and you can start your ambulance time, don't wait till your first faculty session to start. Sometimes the field times take a little bit longer. They're all done at Dayton Fire Department with extremely rare exceptions. And it's a situation where scheduling can be a little challenging because there's limited days that we have available. The hospitals are open quite a bit more flexibly. The key items to work on here is to get your comfort with skills in the field, start getting used to starting an IV in the back of an ambulance and kind of cramped quarters with people all crawling around and walking around you. Work toward your leadership a little bit and your diagnosis skills, but essentially just start getting involved in the process. Watch what the preceptors are doing, but even at the early part of this course, you're probably more than just an EMT observer. You know what's going on. You've been certified as an EMT, so get out and start doing some of the work. Integrate with the crews. Talk with your instructor if you have any questions as to, am I being too aggressive or not aggressive enough? And the early and late sessions that they schedule with you are designed to help with that. At the end of this term, you should have more than half of your ambulance runs done, and you should be pretty much at the halfway mark or a little better than your halfway mark of ALS runs done at the end. Log everything you get. We're going to talk about grading information in a little bit, but the grading information, you're going to get a minimum grade of a C if you do the minimum number of skills. If you do more than the minimums, then you'll have a better chance of getting a B or an A. Finally, at the bottom, if you notice, there's two other segments to your clinical experience, and you can do those at any time. You don't even have to be at one of our clinical sites or while working as an extra person. We've got professional development, which was discussed in your orientation and your lab book, and that's EMS-based training specifically, but 12 hours of that have to be non-911 transport unit hours, so working with a private ambulance. You can schedule that at any point. You can do that even during the breaks between classes if you'd like. It's also okay to start working on your field mentoring subjects at this point. There's 40 different topics. If you have questions on either of those, talk to your clinical instructor or your lecture instructor, and they can point you in the right direction. Finally, we get into the last course, which is the EMS 2180 and the field internship. Everything has to be done here during this term with an oriented field preceptor. When we get into signing up for your clinical sessions, I'll show you where you can find your information of who is an actual preceptor and who is not. Actually, when we talk about the daily clinical logs, I'll show that to you on EMS portal. Don't wait until your first faculty session to start. In fact, I would really recommend that you aim to get this done at the halfway point. In that final term, you have lecture only for the first half of the semester. The second half of the semester, you get both lecture and lab. So that first half of the semester is the ideal time to just bang out your clinical and get everything done if you possibly can. Don't carry that stuff down to the very last minute. Stuff comes up all the time, and people have challenges and unable to finish, and you do not want to be waiting on taking the registry and delaying your progress in the career when you've passed the MOF and you're just ready to get done with this whole process. So please get on top of the forms, get started immediately, and get going. Have to have all your leadership runs done. Everything has to be complete. Your professional development has to be done, including the non-911 transport, and your field mentoring subjects all need to be done.